Ramsay Clinic Hollywood is a dedicated mental health facility providing day programs and inpatient care for a range of mental health conditions. Your inpatient stay is led by our experienced multidisciplinary team who provide individualised treatment.
A big part of the first couple of days, 2 or 3 days, is actually about finding about that person's story, finding out what's stressing them, what's distressing them, and then tailoring the care to that individual. Often people sort of feel really anxious, and that's understandable as well. So a lot of it is about that relationship building between ourselves as staff and the patient. We have mutual expectations here, and that works both ways. For example, we expect a patient to participate and engage in therapy, and here that means group therapy as well as individual work with nurses and doctors as well. We've got a really vibrant light environment as well. We've really thought about the building itself, so there's lots of natural light flooding in. Every patient's got their own room and their own ensuite. It's really important that a patient has their own space. You spend a lot of time working in groups with other people while you're an inpatient, so it's really important that you have that space to then go back to and reflect. We've also got outside courtyards as well that people can chill out in when they're not in therapy. We pride ourselves in having an extensive multidisciplinary team, so that includes a consultant psychiatrist, often a registrar and a junior doctors, but also clinical psychologists, nurses, occupational therapists and social workers. We partner with other Ramsay institutions and hospitals across Australia that allows us to gather that body of evidence to suggest which is the best treatment option for an individual. The difference between Ramsay Clinic Hollywood and other private mental health facilities is that we're part of a bigger hospital. We're at over 900 beds. So if somebody's coming in for a mental health issue but they happen to have another issue that they're struggling with, then we've got access to specialists within the bigger hospital that we can tap into and provide a holistic package of care for that individual. And we've got an emergency medical team that's on site here. So usually people for an inpatient admission will be here for about 21 days. So we have group therapy 3 times a day, so they're 3 one-hour sessions. They're usually of groups between 8 to 12 people. Our therapists are really skilled at trying to ensure that everybody's heard within that group environment and that people don't go away from that group feeling that they've not addressed issues that are important to them. There's quite a lot of formal one-to-one therapy done with people. The patient spends a lot of time with their nurse unpacking things that are really important to them. That's reinforced by time that we'll spend with their treating psychiatrist as well, who will start to understand what's going on for that individual. We've got 2 eating disorder programs, a general eating disorder program and then a binge eating disorder program. Our eating disorder unit takes people from 16 upwards. But within our eating disorder team, we have specialist dietitians. That's really important to work out a diet regime that fits that individual. It's really important that we start to normalise eating because that's part of a person's recovery.
Ramsay Clinic Hollywood also provides a comprehensive range of day programs for a variety of mental health conditions.
We like to consolidate the good work that's been done in that inpatient admission. For us here at the clinic, that means our day programs. So what we tend to do is identify the needs of that individual as an inpatient, and then we have a follow through so that person will actually then slip into one of our day programs. There's 2 ways you could get into one of the day programs. We often transition people from an inpatient to a day patient program, but you can get a referral from your GP. The GP refers in, one of our team will assess the individual and see which group's best suited for them. The biggest outcome that we aim for when we have somebody come to the clinic is that they're in a lot less distress when they leave the clinic than when they came. And that's really important for an individual to feel that they're in control of their life. We give them skills that they can use in their everyday life. That's really important that we allow that individual to take charge of their destiny.